Hello everyone. Let's talk about the most common difficulty faced by women, like urinary tract infection, which leads to burning micturition, increased frequency of micturition, and almost every woman is facing this. Almost like even in once a week we get almost 2-3 patients with urinary tract infection.
Yes, I think so.
Yeah.
And I think it's one of the most frustrating things that women have to deal with. And mostly, women think that it's related to hygiene, but I don't think it's that simple because in the present scenario, I think most women do maintain some kind of hygiene, but it can't be explained in such simple terms that just hygiene is the only factor which is causing a UTI.
Yeah, I mostly think it's like the obsessive hygiene is mainly responsible for urinary tract infection, because women tend to wash their private area every time after passing urine, and all that moisture is leading to more infection, and all this anti-wash acidic pH and all that is also like extreme hygiene. I think that is the main reason, and when we remove all this pelvic hair and all that is increasing all the risk for infection.
And let's not forget the behavioral reasons, like holding urine for too long when you're traveling maybe, or you don't want to use a public washroom, so you're holding urine, not peeing after intercourse, so such. And then, as you said, the inti washes, I think that's the name, the vaginal washes,
acidic pH, they've been marketed very frequently.
So these are basically just chemicals which the body doesn't actually need to clean the vagina that way, right? So we know that the normal secretion, the vaginal secretion, is the body's way of cleaning itself. So using this washes is instead, I think, just denuding the mucosa and then causing more issues instead.
Yes, our body has a natural mechanism to not get any infection, and this natural flora is getting disturbed with all kinds of stuff which we are doing, especially using that showers after that bum shower using after bathroom. So it isn't easy to deal with kind of stuff. We just need to examine the patient and start her on antibiotics and all that stuff.
And I guess for people who are having recurrent UTIs, so for them maybe an antibiotic prophylaxis, or maybe in women who are perimenopausal, starting an estrogen cream has also been seen to be useful, right?
Yes, and mostly diabetic patients are very prone for urinary tract infection. So just keeping sugar in check will prevent any infection from occurring. That is also a take-home message. Any kind of vaginal infection will lead to some form of urinary complaint. So if you are experiencing any vaginal discharge, just see your doctor regarding this discharge, which if it's easily cured, then you will not get any urinary infection.
So basically not to keep repeating the same medication that you have gotten once from your gynec, but instead visiting every time you get an infection to evaluate what is the cause is what is needed.
Yes, definitely.